Okay, so I've pulled up the high-resolution heart image from the Anatomage Table so that we can look at some of these structures using these images. So we've talked about how there's 4 chambers of the heart, and we can see on this image a right atrium with the right auricle protruding superiorly from that right atrium. I always describe this in class as a little pig's ear. Just underneath the right atrium is going to be the right ventricle. If we turn around and we look at the left side of the heart, we're going to see left atrium in this region, and just inferior to that, the left ventricle. So we have described the atria as receiving chambers, and so they're going to be responsible for receiving blood back from the body. And so the right atrium is going to receive blood from the body through 3 veins. And I'm going to highlight these in blue because that's typically how we look at them. So we've got superior vena cava and inferior vena cava that are going to drain into the right atrium. And so if we look at the image here, we can see these vessels. So here, coming from the top, this is going to drain venous blood from the head and the upper extremities. This is superior vena cava. And I can come in and I can flat color this a blue color. So superior vena cava. If we come down from the inferior aspect, this is our inferior vena cava, draining venous blood from the torso and the legs, all heading into that right atrium. And then our third vessel is going to be the coronary sinus. And this is actually draining venous blood from the heart itself through the coronary circulation. So if we actually turn our heart around, so we're looking at the posterior aspect of it, you're going to see this small vessel here. And this is the coronary sinus. I'm going to flat color that blue as well. And that's draining venous blood from the coronary circulation back to the right atrium. So here are 3 vessels that are draining venous blood to the right atrium. Now, the left atrium is a receiving chamber as well. And so if we turn around and we look at the left atrium, we can see that it's going to receive blood as well. And so if we take a look at those vessels, and I'm going to highlight this in red because the left atrium is receiving blood from the lungs. And so this is now going to be oxygen-rich blood because it's already been through the pulmonary capillaries. And it's going to receive blood through 4 pulmonary veins that are going to drain into that left atrium. So if we take a look at what we have here, if we look at the heart from the posterior aspect, what we're going to see is this is our left atrium here, and we've got 4 vessels that are going to drain into it. So if I look at this side, here's a inferior pulmonary vein that's bringing blood from the left lung, and I can actually take that and I'm going to flat color it red. And then just superior to that, we're going to see a left superior pulmonary vein, both of these draining blood from the lungs back to the left atrium. Now, if we look at the right side of the atrium, we've got right pulmonary vein. So here's an inferior pulmonary vein. Oops. Inferior pulmonary vein, and then if we go superior to that, we're going to have the superior pulmonary vein. So this is a posterior view, and we're going to see left and right pulmonary veins draining into that left atrium. So let's talk about some of the structures that are related to the ventricles. We know that the ventricles are described as pumping chambers. And so they're going to be responsible for pumping blood from the ventricle out through a vessel. So let's talk about right ventricle. Here we have right ventricle on our high resolution heart, and we can see that we've got a vessel that's leaving that right ventricle. So what we see here is the right ventricle is going to pump blood into the pulmonary trunk, and this is deoxygenated blood. So this is blood that's heading to the lungs. Pulmonary trunk is going to end up bifurcating into a left pulmonary artery and a right pulmonary artery. And these guys are going to head to the lungs where they're going to pick up oxygen. Okay, so at this point we have got deoxygenated blood that's leaving the heart. And so if we can highlight on our image here, here's our pulmonary trunk that's leaving the right ventricle. And then that pulmonary trunk is actually going to bifurcate into our left pulmonary artery that's going to send blood to the left lung. And we can actually kind of twist around a little bit here. I'm going to flat color all of these structures blue because they're carrying deoxygenated blood to the lungs. And so you can see at this point how we've got pulmonary trunk traveling up and then a bifurcation. And we're heading to left lung, and then on this side we're coming behind the aorta and we're heading to the right lung. Okay, so that's going to be that bifurcation of the pulmonary trunk. Now, the left ventricle is responsible for pumping blood as well. Now, what it's going to do is the left ventricle, on the left side of the heart, we actually have oxygen-rich blood. Okay, so on this side, we've got blood that's already been to the lungs, and now it's heading back again. And the left ventricle is going to pump blood out through the aorta. And so this is the largest artery in the body. And if we look at our heart here, this structure here is going to be our left ventricle, and leaving the left ventricle is going to be the aorta. And so that's going to be here. And what I'm going to do is flat color that red because it is carrying oxygenated blood, and the aorta has several different segments, and I'm going to go through and color all of those red so that you can see that. So here is aorta leaving the left ventricle. We have aortic arch where it's going to kind of bend across and then start traveling down the thoracic cavity. And so those are the vessels that are leaving the ventricles.